Walking into room 1111 into Bob O's room right now. Hey Bob, I'm Bobby Overby. I'm going to be your nurse today. Dr. B ordered an IV and some IV fluids to be given to you. Can I get your name and your date of birth? And 1/1/1965. Thank you very much. I'm going to go ahead and wash my hands. Just so you're aware, this hospital has a very strict 6 rights policy for IVs and medications. So I'm going to be doing all procedures to do today based upon the 6 rights, which are right medication, right route, right time, right patient, right date, and I'm going to also be documenting everything with the procedure. I'm going to go ahead and check the MAR and the doctor's order right now. It is the proper solution, which is normal saline, and we had already done all the setup and labeling in the med room. So right now I'm going to go ahead and place this protective pad under your totally not severed arm, right like that, to keep it the bed and linen nice and clean for you. I'm going to go ahead and attach my tourniquet like that, and I'm going to go ahead and feel for a radio pulse, which you totally have. Going to select an IV site that has no hair, that way I don't have to cut it with scissors. That's a nice vein, it bounces back nice. Alright, and that's going to be the site we're going to select. So I'm going to go ahead and loosen that and leave it in place. You go ahead and leave your arm down like that for me for a second here, Bob. And I'm going to prepare my equipment. The bed's already in a nice position for me. And I brought all my equipment with me here. I'm going to pull out the IV site here. And I'm going to flush that into the garbage can to not make a mess. And I'm going to set this right by the bed here in the little gravy boat to keep that nice and clean. Throw that guy away. Going to get my alcohol swabs over right there. I'm going to prepare some tape. Get this guy nice and close. There's one for the top. There's one for the IV tubing. Another for the IV tubing, and one for the IV site. Alright, so I have my tape set up. I'm going to go ahead and open my clear site here, which I will use to actually have a label already made up for Bob. But I'm going to put that one there. Have that open and set it down there to keep it clean. And I have my IV, which is a 20 gauge IV that I selected earlier. Put those away. And I have my IV still in the gravy boat to keep it clean. I'm gonna go ahead and put my gloves on. And I'm going to cleanse the site here. I'm going to start with some cleansing like that. One. And then start at the site of puncture. Work my way out, and I'm going to let that dry for 30 to 45 seconds since I'm just using the alcohol to cleanse. The bed seems to be in a nice comfortable height for me. I'm gonna go ahead and I'm gonna move your arm over here while that dries, Bob. And we're gonna go ahead and tighten the tourniquet back up while that dries. There we go. That's nice and dry now. I'm going to go ahead and open that up. Loosen that. Going to go and bevel up. Like that at a 10 to 30 degree angle. Going to introduce the catheter. And I'm going to look for flash. Our practice arm does not unfortunately flash, so I just got flash, drop the hub down as I stabilize the skin, thread the catheter forward to the skin, and these catheters I can go ahead and pull that all the way out. I'm going to pop my tourniquet, apply traction, pull that out. Set that off to the side so I can carry it to the sharps in a second. Keeping it clean. And I will go ahead and make sure it flashes, which it does, and flush it. And I'm looking for any puffiness around the site. I'm going to go ahead and flush it with the solution. Alright, it flushes nice, no extra resistance. I'm going to go ahead and throw my flush away. Alright, you go ahead and hold still for me, Bob, okay?
Okay.
Cover the site with that guy. Take that down. Alright, I'm going to, since I got the site, go ahead and pad underneath it for patient comfort. Use that, stick it down. We are going to use this over the hub like that. Okay, and then I'm going to use the label that I had already made with today's date, the size of the catheter, and my initials right there. Alright, so let me go ahead and clean this site up here. Oh, I'll grab that guy here in a second. Get my tourniquet and throw it in the garbage. And I'm going to walk my sharps over to the sharps container. Back. And I'm going to go ahead and set up our IV solution on here. Use an alcohol swab to cleanse the port here, and I'm going to let that dry for 30 to 45 seconds. Fast forward in time, 30 to 45 seconds. And connect that. Alright, so we used a 10-drop IV set, and I'm going to go ahead and prepare my site. A nice loop there. I'm going to go ahead and tape. I'm actually going to tape that just above here at that port, and one more right ahead and count my drops. So I need 17 drops per minute with my 10 drop set for the 100 milliliters per hour that we want. Drop that down. I'm going to go ahead and take my gloves off. All right, Bob, I'm going to get this out from under your totally not completely severed arm. Put you back in a position of comfort. Would you like the head of your bed raised up, Bob? No? Okay. I'm going to go ahead and lower the bed down to its lowest height and raise the handrails for patient safety. Excuse me. And the other handrail. All right. And I'm going to hand, ironic since you have no hands, the call light back to you, to your totally actual hand there. Do you remember how to use that, Bob? All right. Wonderful. So I'm going to go ahead and document the size of IV that we used, the site that we selected, that we used the right solution, and the rate and time it was begun, and that it was labeled. So then I'm going to go ahead and walk off. So
1 hour later.
All right, I'm going to come back into room 1111. Hi, Bob. It's Bobby again. How are you feeling? Can I get your name and date of birth? Bob O. and 1/1/1965. That looks right. I'm going to go ahead and inspect the site here again. That looks good. Is it hurting at all? Nope. No redness, no puffiness. And I'm going to make sure that our rate is still the same here. All right, so it looks like it's the right rate. We don't have to adjust it. All right, Bob, to go ahead and maintain the rate on that, I'm going to see if you could maintain your arm right about this height as long as it's comfortable. And if you need to move, you can go ahead and hit your call light. That way I can come back and inspect your site. Is there anything else you need right now?
No.
Okay, Bob. I'm going to make sure your handrails are up and the bed's again in the lowest position. And you still remember how to use your call light?
Yep.
All right. I will be around if you need me, okay, Bob?
Okay.